Hello all. So in this video, what I'm going to tell you is the narcissistic people and maniac people. If you have that kind of personality traits, then which specialties are better for you? I'll try to tell you why I'm doing this topic. See, there are some doctors I'm saying who survive on chaos, and then there are some doctors who survive on attention. Okay. The first category who survive on chaos are called maniacs, basically. Okay, and I've seen many doctors actually who fit into this category, and then they actually thrive there. Okay, because to actually succeed in those specialties, you require such kind of strength and endurance level which they have. That is more genetic, and that comes from childhood. And second category is the category of people who want attention, and then they want to be the center of the universe. Basically, that is called narcissism. And then there are specialties for such kind of people also. By chance, if you're falling into one of these categories, then these videos for you. And then this video is also for people who don't want to be with such kind of people. Because I'll try to explain. If you're a kind of person who's calm and who can't, stand being with such kind of people, then please avoid the specialties which I'm going to tell you because these specialties are loaded with such kind of people. Okay. And then let us see what exactly the maniac means. So maniac means any person who thrives under pressure. That is a simple definition. For example, if you tell them that a lot of sleepless nights are there, they're like, fine, they're fine with that. If you tell them that there are a lot of emergencies in this particular specialty, they will tell, just bring it on. We are fine with that. So this is about the personality of a maniac. Narcissists are quite different from that. They want attention. They want to be the center of anything. Okay, it doesn't mean they can survive under pressure. They might not be, but still they want to be in the powerful post or they want to be the center of attraction, basically. That is what narcissism is all about. Okay. Now I'll tell you a few specialties where I usually seen maniacs excelling only. Okay. I'll tell you one example. When I'm working, I see, in the midnight, 2 a.m., okay, midnight, a general surgeon operating a case during my post graduation, or even now I see some surgeons operating in the night. It might be a neurosurgeon or a gastrosurgeon. They will be under extreme, focus and concentration even at that point of time. Without blinking their eye, they would be operating. So even with that kind of endurance comes only when you have that maniac mindset. Okay. So if you are a regular person and then if you are not that kind of a personality and if you get stuck with these specialties, you can do regular work, but when you have to go out of your routine, when you have to go out of your this thing, and if it's regularly happening and then midnight you have to keep operating, then you will get, worried. And then you will be thinking, why the hell did I come into this particular area? So that is why I'm telling if you are a low energy person or not fitting into the category of this maniacism, then you can't take these specialities because these specialities require that endurance. So that is the reason I'm doing this video because many people enter off and then they will think that I'm not able to manage. Some people change later on, that also I've seen, but if you are basically built like that, it is best for you. That I also seen this kind of personality in OBG. Okay, OBG when I actually observe the midnight also deliveries would happen, labor epidurals and then cesarean sections and oh yeah. So it is very difficult and but gynecologists are very passionate. Even in the night, they would be so passionately doing that without getting tired. They would do. Okay, if somebody is getting tired and not interested in all that, they don't have this mindset, basically that. So they also enjoy the work. They also enjoy the kind of subject which gives chaos to them. Okay, and I have also seen this in CTVS surgery. Cardiothoracic surgeons also fit into this category. They would be doing CABG even in the night, and re-explorations they would be coming, and then a lot of till morning they would operate, and then they would save their patients. I'm not telling these are bad. These are excellent for the patient outcome, but whether you can fit into that role or not is what you really have to check. Okay, critical care also I felt like that. Emergency medicine also felt like that. Even though it's a shift-based work, during that shift in critical care, a lot of sepsis with multi-organ dysfunction, a lot of infusions, and there are situations where you need to do CPRs and things would be counseling. So many things are there which needs kind of excess adrenaline junkie kind of a mindset. And emergency, if you take, AIMS Trauma Center, if you go in the night, 30 cases would come in the night. If you don't have the capacity or endurance to deal that, you cannot survive there. So that is the thing. So that is about the maniac specialties for maniac mindset, I think. So let's enter the narcissism side now. So what is narcissism? Feeling as a center of the universe, or they want that kind of admiration or something. I'll tell you the examples. So, for example, I can give you the best example is orthopedics. So, I have heard many orthopedicians saying that this particular person is walking because of me. This particular person is actually moving because of me. So, this kind of statements, when somebody is giving, you can understand that that particular person is a narcissistic personality. But that is how I think they will operate. So I see a lot of this kind of personalities in orthopedics, and then even in the medical specialties also, I would see like neurology. I would see this kind of personalities because they feel they're very intellectually strong, and then because they understand brain, they feel that it is a pride that they are neurologists and they diagnose the conditions, and then since brain is the master organ in the body, they feel very narcissistic. And then even endocrinology, I have seen this. Many endocrinology specialists also feel in the similar way. So, uh, so these are the things, and then even the cosmetic side also this would be seen like people who are into the cosmetic, dermatology, plastic surgery, who are into the cosmetic side are more into that Instagrammy life, and then people come to us, they look better. So they are also a lot of narcissism I'm seeing there. But I think these specialities would require that. You only then you can look good in front of camera. Only then you'll have the personality to actually, the charming kind of personality you might have. I think so. So that is how I'm seeing a lot of narcissism even there. Radiology also. Some people would have narcissism because they would feel that they are the toppers in the NEET examination, and they would always show that they got this rank. I have taken radiology, and all these things they would be talking. So these are some of the specialties where you would find people with narcissism. So this is about narcissism, and then there is a third category which is even more dangerous. That is the hybrid category, where maniac and narcissism both can are possible. Here I would keep neurosurgery, CTVO surgery, OBG, oncosurgery. So the combination of both can be there. Okay. And if you ask me, Dr. Dheeraj, so we are not like this, and we are very calm, and I'm not such kind of a person. I just want to be, in a cool specialty. I don't have the energy to be a maniac, nor I don't have the mindset to have narcissism. Then I think the other specialties which I usually, tell in my videos like anesthesia, psychiatry, and then you can go for nuclear medicine, not emergency, nuclear medicine, and even like simple microbiology, pathology, and all the specialties are very calm. And then if you are such kind of a person, they're like it will suit you. But these maniac and other specialties would pay you a lot of money. That's a different subject. So then, this question you have to answer: do I enjoy chaos, or you want to be calm, or you want visibility? Okay, or you want such kind of personalities. If you have, then you have to choose these specialities. But important thing that you need to remember is: can you sustain this for 20 years, 25 years, 30 years, 35 years? Because you'll be practicing for so many years. Right? That is another thing that you have to keep in your mind before taking the decision. So whatever it is, I told you what are the type of specialities which will suit these things. So if you want to stay away from these people, then try to avoid these specialties. But still, anyway, so that's about the video. And thank you guys for following the video till the end. And hope we'll come up with good content in future. Thank you.